So my name is Jamie Tompkins. I'm a family nurse practitioner, and my husband's Dr. Troy Tompkins, and he's a family doc. We are co-medical directors at the City Refuge Ministries in Ghana, Africa. And we have two children, Yvette and Timothy, and they currently are now 14. And they were 11 when we told them that we were going out into the mission field. And we started to prepare their hearts and pray with them. And so, realizing, we're not going to be able to send our kids to school, an American school. So how are we going to, as parents, be able to educate our children while we're out in the mission field? And so looking into different ways, that's been the biggest challenge, is finding a way to educate our kids. So we first told them what God has laid on our hearts and asked if they would like to join us, because our mission is also with our children and they're part of our family. So they actually even teach Shay with us, or when we go out to the communities, they go out with us as well. So our whole family was called to missions, just not Troy and I.
Probably about 7 or 8 years before we went on the mission field, we heard about this group called City Refuge Ministries, and I grew up in Tucson, and there's a small NGO there called Heartbeat for Africa, and I learned about what they were doing and started to do some short-term trips with them. And before, we had always done our short-term trips in Latin America, and even my major was in Spanish, so I felt like God was probably going to call us eventually to Latin America, and maybe one day He will. But we started doing short-term trips to West Africa, and around that same time we also got introduced to community health evangelism. And on our short-term trips, we found that so helpful, because it really was focusing not on just going and doing things for the people, but finding ways that we could engage communities and help them be more sustainable and improve their way of life, and improve their health, both physically and emotionally and spiritually.
We take care of the kids at the children's home, but also the staff and then the community as well. And then there's a school on the campus that we do medical assessments on.
So City Refuge was started in 2006. John Bull's a Nigerian pastor, and Stacy's from South Dakota, and they met through YWAM in Ghana, and both of them individually felt like God was calling them to serve in Ghana even before they met. And John Bull himself had lived on the streets in Nigeria, grew up in a family that really didn't want him, and so he knew what it was like to be a child that that felt neglected. And so for him, it was his passion to do something in Ghana. At first they didn't know what it was, but then they found out about the issue of child trafficking on Lake Volta, and how really very few people were doing anything about it. Oftentimes when they're rescued, we'll see scars on their back from where they were whipped, and so when they're rescued, there's a lot of not just physical trauma, but emotional trauma that they go through, and oftentimes the kids are very scared at first.
Some of their past traumas, I'm sure they have a lot of anger, some of them, and some come out physical, some come out in different ways. Sometimes
they'll even hoard food from the cafeteria because they're not sure if they'll get to eat again, because they're used to only eating once a day. And then once they start to realize, oh no, we get 3 meals a day here, and we get to go to school, and everyone is caring for us around us, then you see them start to blossom and open up, and it's really neat seeing the transformation in these kids' lives, and how quickly some of them really open up, especially when they realize that you love them. But just meeting them and loving these children right where they are, God, I just pray that God continues to give us the guidance to help these children to be able to love themselves, so they can go back into Ghana and change Ghana, or even go back into the communities that they're from. And then regarding Shay, part of the reason why Jamie and I felt drawn to using the model of Shay, both at Quorum as well as with communities, we both have come out of hospital and clinic medicine, and we know the value and the importance of curative care, especially in the developing world, where oftentimes there's not enough hospitals and clinics available. But because we worked a lot in the community setting, the village setting, where oftentimes there might be a small clinic, there might not be anything. Our heart really was for, well, what about all these other rural areas that are far away from a hospital or don't have access to care? How can we help bring care to them? But also, how can we help communities learn to be healthier themselves and not have to rely as much on government or outside help? And that's where we really love Shay, because it's training communities to be healthier themselves, teaching them how to keep from getting sick in the first place, or face some of the challenges they're having, whether it's health challenges or emotional challenges, or even empowering women, helping them realize that they're valuable and that God has a plan for them, and that even though their husband might have 2 or 3 other wives, that God still can use them to be an example in their family. And so we've really found it, for us, we felt like we want to focus more on how can we prevent illnesses in the first place. How can we make it so people don't have to go to the hospitals as much, or find out how to have a relationship with Jesus, even though their community may not have a strong church or may not have a church at all. And so that's what we love about Shay. It's really about teaching people to fish rather than giving them fish, and helping them realize that much of the struggles that they face, they can face together as a community and with God's help. And with some training and teaching, that communities can really keep themselves healthy, both emotionally, physically, and spiritually, even if they're far away from a hospital or a clinic.
In Shay, so when we went out to the trip in 2014, some of the kids that were rescued went with us back into their communities back in 2014, when Troy and I both got the call to go back to Ghana, or that's where God was calling us. So it was nice and awesome to see at that time one of the guys that were rescued from the community actually speaking the gospel to his own people. And it gave him that, I believe that it was that trip that he knew he was going to go into social work. And now he's in college becoming a social worker, and he's going to be able to apply what he's learned in school, but all of his own life experience to go back to the community and to minister to his own community. And so, yeah, it's awesome to see these kids flourish.
There's one thing I really love about Shay, not just worldview towards child trafficking, but realizing each person's value and helping communities think long term, not just how can we survive for today, but where do we want to see our community in 5 years and 10 years, and what can we do to work towards those goals.